मलाई के रिस उठ्थ्यो होला ठाउँमा भएदेखि बा मर्थ्यो बा मर्दैन थियो अनि त्यसो गर्न नपाएको भए पछि मरेको भए पनि त उसको भाग त्यति रहेछ भन्ने एउटा रिस सोचिन्थ्यो भन्ने आफ्नो मात्र बाबा त्यति भन्ने मात्र यहाँदेखि यति त सबै टुक्रा टुक्रा जम्मै टुक्रा टुक्रा पारेर यत्रो यत्रो सन्ना खाले च्यापेर टुक्रा टुक्रा काटेर निकालेको
15 years ago, Indra Maya lost her first baby. For 3 days she had intense labour pain. There were no doctors available, and the baby died inside her womb. It had to be removed piece by piece. Even though Indra Maya has come to terms with the loss, she still suffers from anxiety over her 2 other children. But Indra Maya was lucky to survive. Nepal still has one of the highest maternal mortality rates in the world, with as many as 5 out of every 200 women dying in childbirth. And the figures could well be higher. Studies show that 15% of all pregnant women throughout the world are likely to develop birth complications. Without emergency obstetric care, these women could die. For UNICEF, safe motherhood has become one of its priorities in Nepal. Last year, UNICEF estimated that 10,600 women would have needed emergency obstetric care in just 4 out of Nepal's 75 districts. But only 452 of these women were seen by the hospitals. Nobody knows what happened to the other women. Many may have suffered permanent injury and become socially ostracized. Probabilities are, most of them did not even survive. In remote areas such as these, women are often not accounted for. They simply disappear. After years of unfulfilled promises from the government, a new doctor has finally arrived at the district hospital. Dr. Gunraj Lahani has brought with him a new determination to bring change to an ailing health system. For years, the lack of roads has kept most development and distribution of services away, and the brain drain to the cities has led to an acute shortage of professionals, especially doctors and nurses. With the doctor's arrival, things look set to change. It has been just 2 weeks since Dr. Lahani trudged 8 hours up the long misty trail that links the nearest airport to Digtel. Since his arrival, the number of outpatients has increased from 30 to over 100 patients a day. Dr. Lahani's arrival is particularly important for the women in Khotang. He is an MDGP, a medical doctor in general practice, and is capable of dealing with emergency obstetric cases. Rudra Kumari had complications in the delivery of her first baby. She and her husband, Jit Bahadur, decided to walk for a day from their village to the district headquarters to see Dr. Lahani. Her cervix is scarred, and if it does not dilate soon, Dr. Lahani will have to perform an emergency operation.
त्यो डिसिजन गर्ने घरको मान्छेहरु हुन्छ एउटा कल्चरल हुन्छ धामी ज्याकेट लगाउने के लगाउने अथवा गाउँको लोकल प्यारामेडिक्स हुन्छ उनीहरुले आफ्नो किसिमले काम गर्न थाल्छ र बिरामीको लाइफ अलिकति घट्दै गइरहेको छ त्यहीबाट काउन्ट हुन्छ कि यो ढिलो भइरहेछ त्यसपछि गाउँमा स्ट्रेचर हुँदैन अथवा अरू साधनहरू हुँदैन मान्छे चाहियो बोक्ने मान्छे चाहियो गाउँमा केटाहरू नहोला मानिलिनुहोस् अब 8 घन्टा टाढा छ हस्पिटल लिएर जानु त्यहाँ डिसिजन गर्यो बर्खाको टाइम चाहिँ पानी आउँछ के आउँछ 8 घन्टा टाइम चाहिँ लाइ नै हाल्यो अब अर्को जब अब बिरामी हस्पिटलमा आयो हस्पिटलमा आउन सक्छ त्यहाँ छुमन्त्र हुँदैन मानिलिनुहोस् ब्लडको कुरा हुन्छ एरेन्ज गर्नु पर्यो अब इन्स्ट्रुमेन्टको कुराहरू भयो डाक्टर उपलब्ध छ कि छैन स्टाफ उपलब्ध छ कि छैन त्यहाँ पनि टाइम लाग्छ यो एकमुष्ट हेर्दाखेरि के हुन्छ नि एउटा सुत्केरी आमा जसलाई स्वास्थ्यको एउटा हेल्प चाहिन्छ उसले सुरुदेखि सफर गरिरहेको धेरै जस्तो आमाहरूले आफ्नो ज्यान बचाउनु सकेको छैन ज्यान पनि गुमाउनु परेको छ त्यसको पछाडि बच्चा नबच्ने भन्ने कुरो त साधारण जस्तो भइसकेको छ भनेको आमा बन्न गाह्रो छ आमा बन्ने रहरमै पनि रहिरहेको समस्याहरू हामीले धेरै देखेको छौँ
Dr. Lahani is one of many young doctors posted to remote hospitals outside Kathmandu. Unlike some of his colleagues who don't go to their posts, Dr. Lahani is determined to face the challenge.
एउटै कुरा सबैले सोध्यो कि तपाईँ कति दिन भयो नि किनभने यहाँ डाक्टरहरू 1 हप्ता 10 दिनभन्दा बढ्दैन अरे अनि मैले सबैलाई भन्दैछु 2 वर्ष बस्छु
The difficulties that lie ahead of him are immense. The hospital structure is basic. There is no blood bank, and the equipment is minimal.
मेन त अब अहिले हाम्रो मेरो आफ्नो फोकस भनेको छ नि इमर्जेन्सी अब्स्टेट्रिक केयर चाहिँ यहाँ उपलब्ध गराउने एटलिस्ट हस्पिटलमा त्यसमा सर्भिसहरू डेलिभरी ह्यान्डलिङ गर्ने अब त भित्र रहेको प्लासेन्टा पिसहरू निकाल्ने ब्लिडिङ भयो भने औषधिहरू चलाउने कोही आमाहरू कामिरहेको हुन्छ फिट्स हुन्छ इक्लाम्टिक फिट त्यस्तोमा औषधि चलाउने त्यो सिम्पल कुराहरू जस्तो भयो त्यो बाहेक हामीले यहाँ गर्नु सक्ने के छ भने अब इन्स्ट्रुमेन्टल डेलिभरी भन्छ भ्याकुम डेलिभरी फोर्सेप डेलिभरी त्यसको मुख्य एउटा तत्त्व भनेको ब्लड ट्रान्सफ्युजन हो ब्लड ट्रान्सफ्युजन नभइकन अपरेसनहरू सुरु गर्दाखेरि यदि ब्लिडिङको कारणले हामीले आमालाई गुमाउनु पर्ने हुन्छ त्यसकारण त्यो सुरु गर्न सक्यौँ भने अब सिजरियन सेक्सनहरू गर्न सकिन्छ यो भनेको होल फेज इमर्जेन्सी अब्स्टेट्रिक केयर चाहिँ हामी यहाँ दिन सक्छौँ
परिस्थितिहरू चर्को छ नि त उहाँ किनभने अब पैसा हुनेको त लान्छ बाहिर देश नहुनेको त अब त्यही हस्पिटलमा खुवाएर त्यसै हेरै मर्नुपर्छ त्यस्तो अवस्थाहरू धेरै भइरहेको छ घटना गाउँ एउटा स्वास्थ्य चौकी भएको भने त्यो डाक्टर हुनुहुन्न स्वास्थ्य चौकी कहाँ जानुभयो अनि त्यस्तो पछाडि सबभन्दा नेपालमै पछाडिएको नै अब खोटाङ जिल्लाको अब बाकाचुल गाविस भनौँ न
Jit Bahadur brought his wife to the district hospital. But most women in Nepal do not get this kind of support. Families are reluctant to bear the cost of treatment and drugs unless it is life-threatening. And usually, by then it is too late.
हमारी राजा जहरा खाई मरबे ये हमारी राजा जहरा खाई मरबे ये हमारी राजा जहरा खाई मरबे ये हमारी राजा जो तुम्हारा निया जहरा खाई मरबो जो तुम्हारा निया जहरा खाई मरबो.
In the central plains of Nepal, in the district of Kapilvastu, lives Pardeshni Chowdhury. Pardeshni was 15 when she lost her first baby. That was last year. She was in her 8th month of pregnancy. There was nobody in the house except her grandmother. All she can remember is extreme stomach pain. The baby was stillborn, and now she is pregnant for the second time.
पेटलाई कति भयो नानीलाईको
केही महिना हिँड्थ्यो दे
के जाने चैत हो कि बैशाख हो
बैशाख
बैशाख
होइल हो हाँ बैशाख फराइल टाप
जेठ
हाँ
कति भयो 4 महिना तिमी थाहा चाहिँ छैन अगाडिको नानी गएपछि 1 वर्ष नभएका बच्चा पेटमा राख्नु पनि हुँदैन भने थाहा चाहिँ छैन कसरी थाहा नभएको त तिमी अहिलेसम्म कहिले पनि अहिले त्यो पेट लगाएपछि डाक्टर गएको छैन किन नाइ
थारूको जात जाँदै जानु
अनि तिमी थारूको जातले यो पनि गर्दैन त्यो पनि गर्दैन भनेर के गर्ने त घरमै बसिराख्ने त
अब के गर्ने अब बसिराख्ने
जान्छु भनेर जाने नि हुँदैन
पैसै दिन्न
Pardeshni's mother-in-law, Kukri, has 9 children, all born at home without any complications. Kukri doesn't understand why she has to take Pardeshni to the hospital.
धामी बोलाउने घरै धामी बोलाएर देखाउने हो आमा छ आमासित पेट छमाउने हो कस्तो बच्चा छ मर्या छ कि जिउँदै छ कि कस्तो यस्तो यस्तो भएछ कि कता खुट्टा छ कता टाउको छ आमालाई बोलाएर देखाउने हो
यदि बुहारीले भने कि अस्पताल जान्छु मलाई अस्पताल लग भन्यो भने चाहिँ के गर्ने
त अब के गर्ने लिएर जाने यता कर्जा निकालेर पैसा खोजेर हैन अब यहाँ न पाम्बरी अस्पताल जान्छु आमा मलाई यस्तो दुःख भयो त अब उतै लिएर जाने अब आफ्नै बच्चा हो बाट्न मर्ने भने फेरि पिर लाग्छ होइन र रुन्छ नत्र हाम्रो ठारूको त कहिले पनि जान्न
अब भयो पुग्यो
But Pardeshni is nervous about giving birth. She has joined a women's group run with the help of UNICEF through its scheme of community action process. Each month, women of the village discuss problems that affect them the most, like safer motherhood, child nutrition, sanitation, hygiene, and health. And collectively, they decide on the best possible solutions. They decide that Pardeshni and all the pregnant women in the village have to visit the hospital. The nearest hospital, Bahadurganj, is around 2 hours bus ride away for Pardeshni. The hospital was one of the oldest in the country and had become totally dilapidated. The government didn't consider the hospital worth repairing, and the community then decided to try and rebuild the hospital themselves. 80-year-old Raj Bahadur became the backbone of the project.
हामीसँग पैसा छैन एउटा पनि छैन खाली यता र उता दुनियाको धन्दा गरेर घर घर गएर चन्दा उठाएर रुख जति थियो बिक्री गरेर इटा बिक्री गरेर बिल्डिङमा लागेको लकडी बिक्री गरेर इत्यादि इत्यादि यता जुन छ हजुर
Nepal's policy of decentralization is still not fully implemented, and management in the health service is lagging behind. The community had to initiate their own effort if they were to have a functioning hospital. They approached UNICEF, who offered to build a maternity ward providing 24-hour emergency obstetric care. Even for this, the community is contributing all the bricks.
म त बुढो भइसके हुन सक्छ 2-5 सालको बिचमा खतम हो तो आजको जेनेरेसनले त्यो पूरा गर्छ मलाई पक्का विश्वास छ
Only one of 3 buildings is complete. Raj Bahadur and the local community are still working hard to raise the funds for the second building, the inpatient department. In 6 months, the UNICEF-funded maternity ward should be complete, and Pardeshni might be able to get emergency obstetric care here if she needs it. For her, community action process was the first step towards safer motherhood.
Our community were not aware about their role and responsibility. That's why our hospitals were not functioning well. Management was not that much. But once community will come forward and they will start to work together with the hospital in a cooperation and coordinating way, I think our hospital will have the better service.
Communities are beginning to find their voice. Village representatives who sit on hospital development boards are pushing for better equipment and proper staff attendance. In Bahadurganj, the only doctor is away, and Uma and Junu, the district nurse, are having to stand in for the doctor and deal with any emergency obstetric cases.
Community people, they are taking interest in this obstetric service. They are demanding. They are asking for the health manpower. They are asking for the service. Whatever service at present we are having, they are asking it should be regular.
The 21-year-old Prabhavati is having serious eclamptic fits. But without the proper facilities, there is nothing Junu or Uma can do, and Prabhavati is referred to Butwal Hospital 3 hours away. Luckily, the hospital had full emergency obstetric facilities, and both Prabhavati and the baby survived. Back in Digtal, Dr. Lahani is trying to get his colleagues to work together. He sets them an exercise to disentangle themselves from a human knot.
पहिला यहाँ एउटा डक्टर गणेश राई भन्ने हुनुहुन्थ्यो अरे सबभन्दा पहिला 5-6 वर्ष पहिला म उहाँ 5 वर्षदेखि बस्नुभयो अरे यहाँ अनि जाँदाखेरि बजारको ओल्लो छेउदेखि पल्लो छेउसम्म सबैले फुलमाला लगाइदियो अरे फुलमाला बोक्ने एउटा छुट्टी मान्छे थियो अरे अनि मान्छेहरूले त्यो मलाई बाटैमै सिकायो यस्तो डाक्टर थियो तपाईँले किन आएको थाहा छैन मैले भने यो ठुलो च्यालेन्ज मलाई त्योभन्दा कम भएर त काम छैन त्योभन्दा अलिकति केही गर्नु पर्यो त्यसकारण अब विश्वास बिस्तारै लिनुपर्छ होला
By challenging the status quo, Dr. Lahani and his team have given new hope to the women of the district. And throughout Nepal, it's men and women like these who are making a difference. Through their efforts, women like Pardeshni and Rudra Kumari, who previously suffered in silence, have now started to walk a safer road to motherhood.